Hi, my name is Kimberly, and I am a 40-year-old breast cancer and ovarian cancer survivor. During my treatment, I lost my health care coverage. I didn't know how the struggle would be and how vital my providers would be in my care. Thanks to my provider team working in the background, I was able to get some resources to help with the cost of chemotherapy. A positive change I've witnessed in healthcare was through the pandemic that I became a person. I was no longer a number. I became more human to my provider, or I should say I was treated more humane. They took the time to answer my questions. They weren't just in 5 minutes, in and out. They sat there and listened to me, whether I needed to cry or whether it was them sharing a joke.
Welcome back, Health Impact audience. We are so excited to get our spring 2022, also virtual, underway. And for those of you that have been with us for the last 10 plus years, you're going to have a really, really good time talking about innovation from a high level, but really diving in deeply to see, are we over innovating? Are we over investing in certain things? And of course, that is fairly natural now, given that coming out of the pandemic, there are a lot of decisions that we had to make very, very quickly. There were no, we could look back at things and think that they were mistakes, but certainly not at the time. We had no idea where things were going. And so there are areas that we might have overinvested, a lot of other areas where we might have underinvested. But we've got a major issue, which is that all of the money that we have spent wasn't sitting in the bank accounts. So a lot of loans were taken out by hospitals and health systems. Bonds were offered by hospitals and health systems. And now many things are becoming due, right? And so our chief financial officers and boards of directors are wondering where to invest for both appropriate monetary as well as patient impact and experience needs. So we're going to have a really, really good set of sessions over the next couple of days, discussing all kinds of great topics that we always do. But today, we're going to start with Shannon, who does a lot of work with senior executives, both on the information technology side, but also, generally on the healthcare side, advising them about what to do on a day-to-day basis with respect to technology choices, implementations, how to deliver technology that can actually be used in some small, short period of time, rather than technology that might take years to implement, years to get out. So we're going to have a great conversation about that. But really, where we're going to focus on is the accelerated pace that we've looked at over the last couple of years on voice, artificial intelligence, cloud technologies, virtual health. Lots of buzzwords have been flying around because vendors and solution providers didn't know what hospitals and health systems were going to use. But now that we've got a couple of years under our belts of what patients really are using, what our payers and employers are willing to pay for, what our networks, labs, health systems, et cetera, need from each other. And then finally, as healthcare IT departments within larger healthcare delivery institutions themselves, what has come about on a need versus a desire is around workforce, retention, acquiring new patients that we may have lost. So the world is starting to shift quite a bit, and we need to talk about what that should mean to the technology sector. With that, Shannon, welcome to our first session of multiple sessions over the next couple of days. Tell us a little bit about yourself and what you do.
Well, first, thank you for having me. I'm Shannon Epps. I'm the founder and CEO of Brightwork. We are a health IT advisory firm. We do a lot of work in implementation, and as you said, technology selection. We work with some of the largest health systems in the country. And we also work with some smaller, mid-sized community-based health systems. We've been in the space, primarily most of us, myself, our partners, our VPs come from healthcare. So we don't necessarily come from consulting. And so we've been in the trenches of some of the big decisions about what to implement, where to spend the money, how does the money benefit the health organization. We frequently are asked, what's the ROI? And we've frequently had to defend those decisions. So lots of experience making these decisions around innovation and trying to figure out how does technology benefit the organization and what do we focus on and what should we not focus on?
Yeah. So one of the topics that I'd like to cover today is this idea of maybe we have overinvested in certain areas of innovation. But before we get to that, talk to us a little bit about starting from the smaller end of your clients, going to the higher end. What's the landscape of your, most routine, most common conversations? What are they worried about? And I ask this in one respect because many of us as quote thought leaders or those that write a lot or speak a lot, we bring up topics in conversations like this that maybe not everybody cares about. So having you here is perfect, right? Because you're talking to these hospitals and health systems on a regular basis. What do they care about most when you're being brought in to guide them towards what?
Yeah, there's always some problem that needs solved, right? And it's usually how do we leverage the technology to improve patient care, or how do we leverage expensive technology in a financially solvent manner? And what technologies should we implement to reach our goals? So a lot of times what we do is we spend time working with our clients' boards and executive teams to understand what is the organization trying to accomplish right now? What is the goal here? What is your focus? And our smaller community health systems, for example, are working on things like patient consumerism, right? Turning healthcare into a more patient consumer centric model and getting back to kind of that retail feel for patients, which I do think that modern patients are asking for. Our larger health systems and partners have done much of that already, or at least thinking about that, and are probably more in front of the innovation pieces, doing really more modern innovation, right? That's more focused on AI, that's more focused on widgets and apps. So it really depends on where the organization is at. With our smaller, more community health systems, it's all about making sure that the technology works for the health system, right? That it is there's sort of benefit out of the technology, whether that's improved patient care and clearly defined, clearly measured improvements, or whether it's going to improve some sort of financial improvement. And how do we draw those lines from implementing the technology to showing the board that there is benefit to this thing? And we do a lot of EHR implementations, particularly Epic, which is an expensive piece of software. And so how do we help our clients realize some of the gains from that? That's the innovation that we focus on.
Yeah, that's perfect.
So,
and as you start to guide your health systems towards things like AI, things like more advanced telehealth, voice recognition, stuff that's not normal everyday kinds of things, how do you get them to stop looking at the new shiny object and saying, look, guys, you guys have a lot of technology here. And you use the word leverage several times in your introduction. Leveraging means that it must already be there, perhaps, and you're trying to optimize it, versus leveraging. It doesn't seem to me to be possible if you haven't had the technology in your environment. Or am I reading too much into the word leverage?
No, it's a lot of times what I tell my clients is to try not to get lost in tracking down the shiny objects, right? Pay attention to what is most impactful to your organization. And some of our larger clients that have a lot of funding in innovation, don't always do a great job of paying attention to what's already there, right? They implement a lot of technology that has a lot of functionality that's just being left on the table, that's just not being used. So that's a big problem. And I think as technologists, and this is myself included, sometimes we don't always work with the people that are on the ground and really know the systems that are already in place to ask them, what does this system already do? What's your functionality that you already have available to you? So there's problem of redeveloping what already exists in the name of innovation, right? For the smaller clients, it's again, what are you spending your money on, and how is that going to directly impact your patient and your organization's goals, right? How is it going to move the needle towards what you're trying to accomplish? And so, depending on where that health system is at, if they're not measuring baselines for certain clinical functions like fall risk, for example, when I talk about that piece of AI, right? That's a basic piece of AI right now in EHRs. But a lot of health systems aren't measuring that, aren't using the data to their advantage to understand how to set up best practice advisories or how to set up data analyses to give nurses and clinicians the tools they need to help prevent a fall in their hospital. So that's the kind of AI that I typically recommend. On the other side, there's a lot of discussion about AI and how you can improve processes significantly to reduce cost, reduce headcount in the organization. And, I think a lot of us are cautiously optimistic about the future of AI, but also making sure that the software, there's a there, right? That's really truly delivering upon its promises. So I hope that answered your question, but it really, like I said, it really depends on the size of the organization and where they're at in their journey.
Yeah, no, it definitely does. And it's a complex world, right? So a $100 million hospital versus a $2 billion health system, quite different. But one thing they share in common is they do need some way, whether you call it something as advanced as an ontology or as something as simple as a checklist, to say, before you go choose a technology or look for an implementation, what should you be going through from an expectations or outcomes perspective? So what is in the landscape currently today, Shannon, that you see somebody could just pick up and use as either an ontology or as a checklist, et cetera, to help establish their expectations from which they can derive things like ROI, et cetera? Because I don't think that really exists. And that's one of the difficulties that you probably have when you talk to customers.
Yeah, that's a great question. And it's funny that you asked that. One of the things that is common among our clients, no matter if they're a multi-billion-dollar health system or, a small community-based system, there's not still a lot of governance in the intake process and in the analysis of all of this technology, right? And how does it impact the system? Just basics of and it goes back to this following the shiny object thing, right? And we get everybody in healthcare understands this, right? You get these departments that are siloed that want to accomplish a specific thing, but they don't work with others to understand how that thing fits into the big picture. And so a really simple thing that helps to solve that is just an intake checklist, right? Just a very simple governance process that brings in people like business analysts and clinical informatics and the people from technology that already have an understanding of what the suite of products already are, to help determine, one, or do we already have this? Do we already do this? Does the software that we have already do this? Number two, what is the cost? Number three, which is a really big one right now, and I talk about this a lot, do we even have the resources to implement this thing, right? And most of the time we don't, at least in the time frame that we want to. So following a rigorous process, and it can be, that checklist can be as simple as 10 items, or it can be a process that needs to go through a much more rigorous review and a governance board. And but starting with some sort of intake before the thing is considered is really key.
Sure. And that's perfect advice. In fact, in the non-healthcare, generally traditional enterprise architecture world, we have these things like business architecture, enterprise architecture, solutions architecture. And there are techniques and technologies available to help catalog what you have today. I mean, generally hospitals think I already have an EHR, but an EHR could mean 100 different things to 100 different people. So if that's the case, is it your suggestion that maybe, regardless of size of healthcare organization, because even the smallest healthcare organization is several $1 million of revenue in size, which means they could have an enterprise architecture approach to the world. So if they had a enterprise architecture, business architecture, traditional stuff from decades ago, is that a good start, or is that too much and you're asking for something even less than that?
I think the concept of enterprise architecture is a good one. And we do have a smaller client right now that is in the process of moving his IT organization to a product development and enterprise architecture type of style. The key is, do you have clinical people, clinical leaders as part of that process? Do you have informatics that are part of the process? Because I think when you start to talk about traditionally techie functions like enterprise architecture, I think as an industry, we haven't done the best job of remembering the healthcare side and remembering the clinical side of it. And I think that because we've been kind of archaic in our industry, right? We're known as being a little slow to the playing field. So we're making this big swing towards embedding more tech in the way we think. But at the same time, I think we're forgetting to just go back to the basics, which is patient care. And patient care is a clinically led function. And so making sure that you have those people that really understand what is in place today and how are we using it. And then working with your vendor partners as well, right? There's especially when you have a big EHR in place like Cerner or Epic, making sure that you're partnering with those vendors to understand what it is that they offer and what's on their roadmap. That's one of the things that we do quite a bit. We partner pretty heavily with Epic to understand what's available from them now and what's on their roadmap. And if their roadmap includes some functionality that our client is thinking about implementing, then we kind of push them in that direction because they're already paying for it. They're already licensing for it. It's not a shiny object. Yeah.
Great. And before we get to the overinvestment question, there's this one other key problem that we have that maybe hospitals and health systems can't exactly solve, but those of us that help guide them could solve, and that is working to bring multiple partners together. So in other industries, something as complex as defense, for example, or nuclear or avionics, everybody knows that there's a supply chain. There are integrators, there are consolidators, there are solution providers. But in healthcare, we don't actually have those nice disciplines broken out. What are your thoughts, Shannon, about using companies like yours to say, look, hospital health system, yes, you're going to need more than Epic. Saying that is like the obvious statement of the year. Yeah. But what they might not know is that there are 9 partners that work really well with Epic, because you already have Epic. You want to use these 9 partners rather than these other 90, which might be awesome as well, but they really work well with Cerner. And if you don't have Cerner, it doesn't really help you to have these other 90 partners. You want these 9 because they work with Epic. How much of that do you believe is your responsibility as a tech guidance leader versus leaving it up to hospitals and health systems to kind of like cobble their own integration strategy together?
That's a big part of what we do and a big part of what we market, actually. We try to see ourselves as kind of a middleman, a shepherd, right, to help guide our clients through this very noisy environment, because there's so much tech available right now. And there's a lot of investment going into health tech innovation right now. And so it's really difficult for a CIO in healthcare who's just basically mostly trying to keep the lights on, right? Trying to keep their resources happy and staffed and trying to answer the call of their stakeholders, because, a CIO typically doesn't have the luxury of going out and shopping for innovation without some sort of pressure from the organization, right? Their stakeholders are asking for a million things. So it's really difficult to understand what's available, what's meaningful, what has a good reputation and what doesn't. So we spend a ton of time even starting in January, we go to CES and really start to understand, CES has cutting edge health technology. We spend a lot of times at HIMSS on the floor, really understanding what is available, what's coming available, what do our EHR vendors support and recommend, and how are they looking at that integration among technology. So yes, we really do think that is part of our responsibility to understand the big picture and where should our clients be investing their dollars and where should they wait, right? Because some of the innovation is just maybe a little bit too soon for healthcare providers. So we have to, and like I said before, every client is different, right? Just like each of us, we're all in a different place in our own personal journey. So what is going to be meaningful and impactful for one client is not going to be the same for another.
No, that's a great advice. And in fact, just as a slight editorial to our health system senior executives, what you want to start to do is you're always going to get inundated with a variety of different solution providers, et cetera, coming to you saying they've got the next best thing. And oftentimes they are right. What you really want to ask them is, that's great. How do you work with our partners A, B, C, and D?
Yeah.
Because if they don't figure it out for you, you have to figure it out for them.
Correct.
And why do the work for them when they're willing to do it for you for free? So here it becomes your job as a CIO, CTO, CFO, CEO to say, hey, let me make sure that Shahid, if he's got a great new idea, can connect with Shannon, who's already in our shop. Mm-hmm. Let me get those two guys off on their own. But that introduction coming from the health system is meaningful for a small company. If I created something to work with a bigger company, let's say you work for Epic, for example, Shannon, that tie in to connect from the hospital or health system, who might be the ultimate buyer, can save them a lot of time. And I think that's something we need to practice a lot more in the industry, is pre-partner, connect up, and then go to the health system together. Yeah. And of course, the big boys, like the Cerners and the Epics, they're much more difficult to do that with. But there are lots of medium-sized players that are more than happy to work with smaller players to say, okay, let's work together. I'll take my fall detection AI, connect it with your information blocking technology and records release process to connect them together. And then we can go to hospitals and health systems. Would you recommend that to the smaller providers, the innovation providers, to pre-partner before going in?
Absolutely. Not only to pre-partner, but to work with the bigger vendors if you can. And there are definitely ways to do that. If you're going to HIMSS, just walk up to the Epic booth, walk up to the Cerner booth, and have some conversations with people about what you're trying to do. That we do the same thing. We have a couple of widget solutions that we provide, and we try to align with the larger vendors to understand what it is that they're trying to accomplish, and what it is that we're doing. Does it align to their goals as well, right? I always joke around, never get misaligned with the mothership. So that's goal number one. But vendors partnering together, coming up with a consolidated solution that meets the needs of the healthcare system and truly meets the needs, right? Don't make an assumption that your software is the greatest thing that ever existed, right? That your health system target is going to need that thing. You really got to think critically about whether or not it is truly going to benefit the health system that you're going after. And I personally think that there is a lot of tech. There are a lot of vendors out there that have this assumption that their thing is the greatest thing. And don't do the critical thinking to realize, is it the right thing for this customer, right? Because it might not be the right thing for a particular customer.
Perfect. And in fact, just as a quick anecdote, I talk to startups and solution providers fairly routinely. And this is my one piece of advice to them is, if you have to go to your customer and ask them how you could help them, you're not actually giving them any help, right? Because this is what they do. They go, I've made this great thing. Can you introduce me to someone at a hospital where I can talk to them about how we might be able to help them? Dude, I was like, if you have to ask them how you might be able to help, you have no idea whether you can help them or not. And they're not going to give you time. Some of them are very nice. They're kind people, But why bother them?
Yeah.
Go talk to their partners, the ones who are already there. Don't bother the hospital yet. Bother the other vendors, because you can help the vendors make more money, increase retention, add more licenses to their products, et cetera. So it's a really good piece of advice to say, especially on the pre-partnering side, vendors and solution providers might want to reach out to you guys to say, okay, how do we help pre-partner and get into hospitals and health systems to help with this one area? And I know we promised about talking, we've got a few minutes left before we finish up, but let's talk about that area of potential over innovation, over investment in innovation. You said a few minutes ago that sometimes we're slow to the party. So the idea, it seems like an oxymoron to say that a hospital health system is over invested in innovation, but that may have actually happened. Any color commentary about where you see maybe hospitals and health systems have spent more money in certain areas that they shouldn't have? They need to pull that back and redeploy it in other areas?
Absolutely. I think over innovation is definitely a problem in our space right now. And I would say that it goes back to what I talked about earlier in our conversation. It's over innovating and developing solutions that already exist with the software that you're using today. That's the problem. So in the case of Epic and Cerner, when our healthcare clients are spending millions of dollars a year in maintenance and licensing fees, it doesn't do that health system, and then by default, the patients in the community that health system is supporting, to develop new tech that already exists. That's money that could go into optimizing the existing software and improving the existing software. So, it's a weird dichotomy, I think, right? We need to over innovate in a way, right? We need to make mistakes in technology in order for us to make progress. But at the same time, it's tricky to understand where that line is, right? Where are we spending too much money? And the larger healthcare systems in this country, I think, are doing a good job in kind of moving the needle, right? Pushing the boundaries. But for the smaller health systems that are just thinking about, how do I improve my network, right? How do I stay independent, right? How do I make sure that I have enough patients coming in to, stay viable? It's really critical to lean into existing software where it exists, and make sure that you're not trying to develop something that is already in place.
Yeah, and if we can give, in the last couple of minutes that we have, Shannon, a framework for thinking for our senior executives. So assuming you're a health system which is going to be in the healthcare delivery business. A lot of people are trying to get out of it and do other things, but let's assume you're in the healthcare delivery business. Here are your quick framework ideas. So number one, what do you need in order to attract and retain patients, right? So you say, okay, well, what are the demands of my patients that are making them walk away? That's a great place to innovate on. And there's not always a quick feature you can turn on in Epic to make that happen. Perfectly reasonable to look at that. Then there are things that payers and employers need to help pay you for the work that you are doing. So if you need fundamental technologies that would help you aggregate data, prepare that data better for claims processing, watch your claims to make sure that your claims are being paid appropriately, those are also very, very good. And sometimes they are so unsexy that one does not think of them as an innovation. It's just as much as of an innovation to improve how an invoice looks to a person with visual impairment, so that they pay their darn bill. That's just as innovative. And in fact, we're going to cover that topic here at Health Impact, about how to make software more accessible so that people can pay you easier, right? And then there's the issue of your network participants. Health systems connect with labs and images and imaging centers and pharmaceutical companies, et cetera. What are the innovations that you need to improve that supply chain are very, very good to be thinking about. Are those the kinds of ways that you're advising clients, setting up these kinds of frameworks to help them and say, look, you got to think about these areas. And the way you said it was perfect is, what are you trying to accomplish this year? Your board has probably already given you the goals. If every piece of technology that you're buying is not aligned to that goal, probably not a dotted line, I mean, a straight arrow to that goal, it may be overinvestment. Is that about right?
I think that's about right. And you laid out a really a really good framework, right? And it is truly about getting back to basics, right? What are we trying to accomplish? Everyone is trying to make sure that they attract and retain patients and then take good care of patients, right? So it's not just about attracting and retaining customers, it's about attracting, retaining, and then providing good care. On the network integration piece, we're still pretty far away from being an integrated health system. Payer and health system integration, it doesn't totally exist right now. And there are a lot of systems that are thinking about that and starting to do things there. So that's a great area for clients to focus on, is just that integration. And then as far as the community network partnership goes, there's a lot of good processes and technology that's already in place there to build upon the networks that exist. So I think that's a perfect framework, Shahid, and a good place for organizations to start. I think that middle one, that network integration, payer and provider integration, no matter how innovative the health system is, that's an area that really needs improvement. So that's an area that health systems should focus on.
And so we're out of time right now, but as you guys heard with this, we're going to be talking about all these topics the rest of the day, today and tomorrow. Please reach out to Shannon and her team. They'll be very, very helpful. As you saw on this call, they know what they're doing and could be quite useful from a prioritization perspective. And as you've often heard, is if you have 100 priorities, it means you have no priorities, right? So bring in experts like Shannon to come in and help you prioritize, tying to your to your things that your board and your senior executives need, and your technology decisions become a lot easier because of that alignment. So with that, thank you so much, Shannon, for giving us your precious time here, and hope you'll stick around with us for the rest of the day as well.
Absolutely. I'm looking forward to the rest of the conference. Thank you so much, everyone.